Thank you. Next, we will go to Chairman Walberg.
Thank you, Mr. Chairman, and thanks for the panel for being here. And while I have you here, letter carriers, I want to say thank you for the service you provide. Being in a rural area myself, it's a rural letter carrier. I think of most recently retired Gene, who took special attention to my late mother, who lived in a cottage on our property out on the farm. And Gene always was sure where my mom was at, and special needs were cared for. I didn't get the same care, but my mom did. So thank you. Thank you for the work that you do day in, day out. Last Thursday, Congressman Joe Courtney and I introduced H.R. 3170, the Improving Access to Workers' Compensation for Injured Federal Workers Act. This bipartisan bill amends FECA to allow injured workers to receive treatment for work-related injuries from state licensed physician assistants and nurse practitioners, which in my neck of the woods are in many cases the doctors in the rural community. This is prohibited under current law and is contributing to long delays in care for many federal workers. Delays in care means delays in injured workers returning to their jobs. Nurse practitioners and physician assistants are a critical component in our healthcare delivery network. And if we are trying to make the federal government more efficient, it makes no sense to prohibit workers from receiving care from a reputable NP or PA. H.R. 3170 updates the federal employees' compensation program to make it more efficient by improving access to care and getting federal employees back to work quicker. Mr. Szymendera, as I mentioned, under current law, only physicians can certify a worker compensation claim in the FECA program. That's why Congressman Courtney and I introduced H.R. 3170 to allow NPs and PAs to treat FECA beneficiaries. Can you describe how this change would increase access to care for injured federal workers, especially for those in rural areas?
One of the great strengths, one of the great advantages of the FECA program is the right to choose your treating physician. That is a right that is not given in a number of state workers' compensation programs. However, there have been persistent complaints about FECA and the other OWCP programs that while you have the right to choose your treating physician, there isn't a treating physician available for you to choose, especially when you are outside of the Washington area or other metropolitan areas that have potentially a lot of federal employees. Expanding the pool of providers to include nurse practitioners, physician assistants, or as I think their National Academy now prefers to be referred, physician associates, could expand the pool and allow greater access to physicians. It also could bring certain non-traditional facilities such as urgent care clinics or medical clinics in retail stores into a greater role in providing care. The question that would have to remain to be seen is, would this be enough to offset the problems that have got us here in the first place with why we don't have enough physicians doing the treating? I have heard complaints about issues with the billing system, issues with frequent changes in the payment system that frustrate physicians and their staff, difficulty with websites, including difficulty that the claimants have navigating the website where you can find a physician, and an overall lack of awareness, for lack of a better word, marketing of the program to providers. So, increasing the pool, I think, would increase accessibility, but it's not the only potential solution to the problems of access to medical care.
But it's a start. Okay, thank you. In the final few seconds, Mr. Santos, you intimated the need for the ability for OWCP to access Social Security information. Expand on why that would be an important asset.
Thank you, Mr. Chairman. It would be very helpful for OWCP to have access to both Social Security wage records as well as the National Directory of New Hires. It would help, OWCP would be able to more quickly identify unreported income by claimants as well as detect claims who have returned to work. It would also allowing for the timely and automated matching, cross-matching of these systems would improve fraud prevention overall, improper payments prevention overall, as well as help the OWCP direct its very limited resources to those claims that require more attention from a fraud prevention perspective. And on the back end, it would assist the OIG in our efforts to investigate related crimes.
Yeah. And save the proper funds for the proper recipients.
That's
So
right.
thank you. I yield back.